Some of the hardest questions that we get about immunotherapy is really how does this work and how does it work differently from more traditional therapies like chemotherapy. For chemotherapy, it really directly affects the melanoma or whatever type of cancer that it's affecting, so patients can oftentimes see and feel kind of immediate changes after they receive a treatment. With immunotherapy, it's a much slower process because it's working directly on the immune system, which then has to target the melanoma or the cancer that the patient has. So it can be it's a slower response, it's a slower period of waiting to see those improvements. So one of the hardest things is really kind of having the patience and kind of being able to wait until kind of that first scan or the first sign that things are improving. I think the whole cancer diagnosis is such a roller coaster, so it's waiting to have that, get the biopsy result and then waiting for the next surgery or waiting for the treatment to start. And so while people can be somewhat used to that waiting, it's one of the most challenging things. So with immunotherapy, because it can take a little bit longer to work, it sometimes can add to that. On the other side of things, some of the targeted therapies that we're using right now really work very quickly. So if someone had just received a targeted therapy where they saw immediate response, then waiting for the response from immunotherapy can be even harder.